Hello and welcome to another episode of the Health Notebook. Today we have Pauline Jonkers in the studio, who is accompanied with her husband. She's been diagnosed recently with colon cancer, and she's here just to give the viewers some understanding of her experiences and what she actually went through during this period of diagnosis and treatment. Pauline, welcome to the studio. Mr. Jonkers, welcome to the studio.
Thank you.
Thank you.
So can you just maybe tell us a little bit about yourself? Pauline?
Okay, I'm Pauline Jonkers. I am 50 years old, got 2 daughters, and I was diagnosed with colon cancer in mid-2015.
Okay, so when you say you were diagnosed with colon cancer in 2015, what were the symptoms? Did you have any symptoms or signs, or can you just give the viewers some idea what led up to the diagnosis?
Okay. From the beginning of 2015, I had like heartburn, irritation, and with eating, like on my chest it was quite heavy. I was then sent for a gastroscopy, which was normal, and then the doctor also requested a colonoscopy.
Okay.
Humanly, I tried to prolong this, and eventually in July 2015, I went for the colonoscopy and was then diagnosed with the colon CA.
Okay, the colon cancer. Okay, so Mr. Jonkers, now you also part and parcel of this process. How did you feel, or what went through your mind during that period of time running up to the diagnosis?
Well, obviously for me as the husband, I thought, why again? Because why again? Because, and why I'm saying why again? Because she had 2 cancers before that.
Okay.
And being diagnosed again with cancer, it really caught us by surprise, caught me by surprise, and I felt very hurt by when she told me that the doctor mentioned that she had, when they did a colonoscopy, that they found polyps.
Okay.
All over her colon, and then she will be referred to another institution for further tests to be conducted, and then they'll take it from there. But as the husband, and also knowing knowing our family members who died of colon cancer, it put fear into me.
Okay, so you, at this moment in time, you've mentioned something important as well. You've mentioned previous diagnosis of cancer. Can you maybe just elaborate a little bit on that? Was it related to the colon cancer, or what was?
They couldn't. Okay, in 2004, I had a sport injury, and to discover, I had to have a laminectomy with a discectomy because of the hip pain.
Okay.
And then in 2006, also at the beginning of the year, I had like a slight lower back pain. Went to the doctors, did tests, couldn't determine, but then were referred to the gynae. When I got to the gynecologist, ultrasound was done, and they discovered that one of the ovaries, there was a growth on.
Okay.
Right?
And then they managed it further from there.
And they managed it further from there.
Okay. Now, running up to your colon cancer, you have the medical practitioner sitting with the 2 of you. What was your thoughts when they said, Pauline Jonkers, you have been diagnosed with colon cancer? What was your thoughts, your particular thoughts at that moment in time?
At that moment in time, I was shocked out of my boots because my dad died of colon cancer. And I thought, why me? A lot of questions ran through, but I had to stand firm and be strong because the both of us were in the consultation. And I had to pose myself, not to show that there was a little bit of fear.
Okay. And what were your thoughts when you were present at that particular meeting when they made the diagnosis?
my thoughts were, oh no, not again, as I said earlier on, and as I said, because of the experience that we had with people who were diagnosed with cancer, and she always telling me that colon cancer is the one cancer that when people are diagnosed, they go quickly. And I asked myself, she always mentioned go quickly, so does this mean that she's going to then die of this cancer?
Okay. And that was in 2015, and now we're 2017.
In 17.
Okay. And what did your children say about it? Obviously, you mentioned you have two daughters. What did they say about it?
Well, the eldest was very aggressive because she couldn't, with the first cancer, she couldn't handle that. She had like treatments with psychologists, and she was carried through. The younger one was more the stronger one. The reason for, I'm going to explain to you, I used to work in an oncology section, and from school I used to fetch her, and she could see how the patients look.
Okay.
So that's why she could relate better.
Okay. And so you've had the consultation. Do you think that besides seeing the medical practitioner, did you go and see someone else in terms of providing support, the social worker or psychologist? Did you go and get support from those particular other healthcare disciplines?
At first we didn't.
Okay.
We Christians, so we are strong believers to first put our trust in God. First consultation we went alone, but the next one I requested that the girls go with to the profession. How can I say?
Was it a counseling session? Or?
Yes.
Okay.
Because what transpired is a lot of tests was done and genetic testing.
Okay.
And then the geneticists did counseling with us and then referred us to psychology.
Okay. And do you think that it added value in helping you manage that particular period
Yes,
of time?
most definitely.
Okay.
It did wonders. Hey.
Okay. Now during this period of time, you were also employed. You've been employed for quite a long period of time. You've mentioned to me before we started the recording. So can you just explain to the viewers what type of work you were involved in?
I work in a patient admin sector, in the private sector, oncology. So being the doctor's PA, I had a lot of involvement with the patients. So to me, when I was diagnosed, I knew what to look out for. And my biggest fear, like I mentioned, I had a fear, was a stoma bag.
Okay. And now, how did it affect your job? Okay, so mentally, you've got the diagnosis. You're still continuing to work as well. Were you able to cope during that period of time?
There was times that I couldn't, because when you look at a patient and you see what they're going through, and you know you're going to go through that same road, it put a little bit of, you feel down.
Okay.
You feel there in the gutter.
Okay. Mr. Jonkers, obviously she's mentioned about building self-esteem and having faith as well. What type of support did you provide her, during that period of time, as a husband?
As a husband, yes, because we are a very close family. I immediately, I'm a very involved person in our community. I serve on a lot of forums in our community, and even in my work, I used to travel a lot. I immediately gave up all those extra activities that kept me away from home, some for weeks or nights, to attend meetings, because I knew now I have to focus on my family and support my wife 100%.
Okay. And so you had the diagnosis. It started to affect your work, right? When did the surgery take place?
It took place 3 months after diagnosis.
Okay.
Because genetic testing was done and they had to wait for that results, which they told me 6 weeks. And then also to schedule the theatres and stuff. exactly 3 months.
Okay. Now, in terms of the surgery and the preparations for surgery, just explain to the viewers a little bit about the preparation for the colon surgery that you had as well.
Okay. The first colonoscopy was done, and then for the digestive enterologist that performed the surgery, he preferred to do his own colonoscopy. So I had to go in a period of 7 days again for another.
Okay, so it was a number of investigations.
A number of investigations, bloods to be taken, and also preparing you for what lies ahead.
Okay.
So.
And what about scans and?
Yes, I had to add a lot of CT scans, which was from the chest down to the abdomen, and also I don't know why a brain.
Okay.
CT also.
So I think the most important thing is to identify if there's any spreading of the cancer. So that's why they would evaluate all areas as well.
And I had to go on a weekly basis for bloods.
Okay.
Where they did also a lot of testing to see if all the organs is functioning properly, I think.
Okay.
And then surgery was booked, and they informed me that I'll be 10 days in hospital.
Okay. Now, your thoughts before actually going into theatre. What were your thoughts first, Mr. Jonker, before your wife went into theatre, and then we can ask Pauline?
Well, the morning before she went for theatre, obviously, like she said, we have a strong Christian belief.
Yes.
And we have a strong Christian belief, and we believe in the power of prayer.
Yes.
And we believe that although physically she's going through this challenge, we also knew that spiritually we can become stronger because of our faith. And but we are human. We have doubts. We have fears, as I said earlier on. And so the morning before she went for the surgery, we had to go to the stomologist in Hartfield.
Okay.
To do the markings for where the bag was with the bag. And you heard previously she say she was fearful of that bag.
Yes.
And I was also fearful of that bag because, like I said earlier on, we know people who had a similar type of cancer, and we knew the effects of the bag, and the bag was a bit of a fear to us. Although we knew that the hospital where she was referred to for the operation had a good record, and it was a good doctor that was going to attend to her. We knew that she was in good hands, but we had fear.
Okay, and now your thoughts before going into theatre and when you're on the operating table, when they're about to put you to sleep.
My thoughts were, am I going to wake up? Because I had a lot of surgeries now with anesthesia, and this was going to be a long one. They told me it will be 6.5 hours, and that was also a little bit in my back of my mind. Will I wake up okay?
Okay.
And funny enough, he mentioned it when we went for the marking. I was
for the stoma bag.
For the stoma bag, they had to mark both sides where the bag was going to be placed.
Okay.
If anything goes wrong in theatre.
Okay.
And then while being in that little office, my poor husband, he had an anxiety attack. I thought it was going to be me.
Okay.
But it was him. So I had to first see to him. And
so you managed your...
I managed. And I said, I'll drop you so that you can be attended to a doctor, and I'll take myself.
Okay.
But also, like we said, pray. I prayed and said, Lord, give me the strength, because I'm going now, but then he went with me, but we got there safely. He couldn't walk. I had to tell him, breathe now in, out. Because
on the day of the operation?
On the day of the operation. This is 9 o'clock. I'm supposed to book in 10 o'clock.
Okay.
But we got into the ward, and the sister noticed that. And then she said to him, just put your head down. And Mrs. Jonkers, Well done.
Okay. Now that's excellent.
Yeah.
Now you're going through the surgery. How long was the surgery when you woke up?
When I woke up, I never had a clue of time. I woke up, I remember I was in ICU. When I turned my head, I looked and I saw through the little glass window 3 faces peeping at me. It was him.
Okay.
Him and the 2 girls.
Okay.
And then I was out, but I think it took them longer. Well, am I sick?
It was 20 past 7 the night
Okay.
when the doctor phoned me, and he said to me that he is done now. We can come through, but before we come, he just want to give me news. He's got bad news and he's got good news.
Okay. So what was the bad news first before we go to the good news?
He said to me the bad news is that he is sorry that the operation took so long.
Oh, okay.
But the good news is that he could get away without a bag.
Okay. Okay.
And he said, I'm telling you this because I know this was your fears, and I could manage to get away with it, and I know that you will be happy, and the operation was a great success.
Okay. No, that's good. Now, you went through the surgery. Did it give you any chemotherapy after the surgery?
Yes.
Okay. Was that immediately? What was the time period in that?
After surgery, I had to go back to the oncologist, and the oncologist explained to me that she's going to give me 8 cycles of chemotherapy, and on a 21-day break with 1 week resting period, and bloods every month before chemotherapy.
And this is in 2015.
I started, yes, and it went into 2016.
Okay. Now you've mentioned 8 cycles of chemotherapy. When people hear chemotherapy, they're very fearful as well. So what were your thoughts in receiving chemotherapy? So just give the viewers some idea.
Okay, my thoughts were, with chemo, we're gonna get this bug.
So it's about staying positive as well.
Yes. After surgery, I was offered 8 cycles of chemotherapy, and the chemo, I would phrase it like this, it put me in a positive light.
So it reacted favorably.
Favorable towards, yes.
Because chemotherapy affects each individual uniquely. Okay, and now in terms of side effects, did you have any side effects of the chemo, or was it very minimal?
Whilst on treatment, I had a little bit of side effects with the normal that we get over. When you have it, your system gets broken down, but there is like ways that you can build it up: fresh air, lots of fresh fruit, your support base, and everything that needs to be in place. So
this is now, it's about regenerating yourself after the extensive cycles of chemo. So what did you do? Okay, you've mentioned about eating healthy, and what else did you do to build yourself up after that chemotherapy cycles?
Okay, what we did as a family, we used to go for little walks on the beach, fresh air, spend quality time just with loved ones.
Okay.
And then also, only after chemotherapy, I developed a delayed peripheral neuropathy.
Okay.
Which is, with tests and stuff again, we discovered that my nerves were damaged.
Okay.
So it's only my fingertips and my feet. I walk with a slight gait, and my fingers is very sensitive, the tips to touch, painful and things like that. But other than that, I'm good.
Okay. Now, do you still continue to have your follow-ups as well?
Yes. If I still do it 3 monthly, it will be for 2 years, 3 monthly, and then 6 months, and then yearly. And also with a subtotal, the colon is not there, so I do a sigmoidoscopy.
Okay.
once a year.
Once a year, okay. Now, before we end off, I'll start off with Mr. Jonkers. What's your message for the viewers out there regarding going through this experience, so that you can give some of them some hope for those that are going through some similar experiences as well?
I would say to the viewers, do not give up. It's not the end of the world. Although, like I said in the beginning, when you hear this news, it's not good news, because with colon comes almost like a death sentence. Almost like, the person is now being diagnosed with a terminal ill disease. But it's not the end. And I would advise people. People always ask, how did you get through it? How did you stay so strong? And you know what is my answer to them? My answer is, talk about it. Talk about it, speak to people. When people ask us very frequently, how is it possible for you people to speak so openly about cancer, about the fact that your wife is being diagnosed? They would say to me, normally people would hide it. They would say, no, my wife is sick, she's not well. But you disclose everything, you are open about it. And I would say to them, just because we were open about it and spoke so openly about it, it also gave us inner healing.
Okay. Now, just to explain to the viewers, there's different stages of cancer. Yours was picked up in the very early stage, which makes the outcome much more favorable.
Yes.
Now, taking that into perspective, what would your message be for the viewers, Pauline?
There's hope.
Okay.
When you get diagnosed with cancer, it comes as a shock, but you need to stay positive and stay focused. And don't, with my first, I'm going to tell you now, with the first, I was like like an introvert, didn't want to speak about it, didn't want to tell my kids. But with the second one, I was open, and we all could receive the message together, and we worked on that and planned our way forward. So it was a good journey, I must say. This one was a much better one. Although it was huge, but it was a better one.
Okay. Thank you, Pauline and Mr. Jonkers, for coming to the studio. It is much appreciated. So there you have it, a remarkable woman who has survived her second episode of cancer, and she's currently working, and she's an example of life after treatment, where you can actually get back into society and be a productive person. And it's also important to detect these cancers at a very early stage, so that appropriate treatment can be provided. So thank you for watching. Stay tuned for another episode, same time, same place, next week.
The large intestine, or colon, is a part of the gastrointestinal tract that makes and stores stool. It includes the ascending colon, transverse colon, descending colon, and the sigmoid colon. The cause of cancer is an uncontrolled multiplication of cells lining the colon. Before a true cancer develops, it usually begins as a non-cancerous growth called a polyp. Certain people can have multiple polyps in their colon, which are inherited genetically. Over a period of several years, a polyp has the potential to become cancerous. A cancerous polyp grows rapidly in size, eventually breaking through the wall of the colon and spreading through the tiny channels called lymph vessels. The cancer can also spread through blood vessels to other parts of the body. Symptoms of colon cancer are blood in the stools, a change in bowel habits, resulting in either more constipation or diarrhea than normal, abdominal pain, unintended weight loss. Treatment. Treatment varies depending on the stage of the disease. Some patients will need surgery to remove the diseased segment of the bowel, followed by radiotherapy or chemotherapy.